Do you know how to read a vitamin and food supplements fact labels? I'm going to tell you in a while. My name is Subirio Bogo. I'm a medical doctor and specialist in public health medicine. I'm also the host of Kiki Afia Happy Birthday Wellness Quiz, your health promotion and disease prevention podcast, brought to you by Kiki Afia. Today is day 123. Now, if you've bought any vitamin, mineral, or any food supplement, you basically see some terminologies that I've shown here. You'll probably see something called UL. It stands for upper limit. You'll basically see nutrients, vitamins, and minerals. What I have in black are vitamins. The one I have in blue are minerals. And then you'll see terms like milligrams as well as micrograms. As I said, vitamins and minerals, also called micronutrients, are required in small quantities, and we usually measure them in milligrams and micrograms. Now, people who use vitamins supplements are susceptible to what we call dose insensitivity. This idea that vitamins and supplements are good and healthy, so if little is good, more is better. And manufacturers even take advantage of this to sell some very high dose multivitamins. So if you consume anything above the upper limit of normal, you could be at risk of toxicity. Now, just a bit of recap. A microgram is 1 millionth of 1 gram. A milligram is 1,000th of 1 gram. Now, sometimes you'll see terms like international units. International units is a measure of biological activity and is different for each vitamin and mineral. Remember, it's not the same as milligrams or micrograms. International units measure the biological effect of a substance, while milligrams and micrograms measure the mass of a substance. The benefit of international units is that it provides an international standardization of substances, but you can't use international units to compare different substances. So remember also some vitamins, we do not have enough data on the upper limit, the ones I've shown here. So this is now a real example of supplement facts label. I want to take note of the following thing. Serving, we need to know what's the serving, amount per serving, percentage daily value, and then upper limit that I've talked about. So remember, they will not give you this figure, the upper limit. It will not be indicated. So if you look at this vitamin, let's start with the serving. The serving size here is 1 tablet. That means if I consume 1 tablet of these multivitamins, I'm getting all these vitamins. I'm consuming all these vitamins just from 1 tablet. I'm consuming these amounts. So supplements should have a dietary facts panel. It shows the percentage, the amount per serving, and the daily servings. The daily values are also called recommended dietary allowance, are the amounts of vitamins and minerals needed for adequate nutrition in most healthy individuals, and usually it is per day. Daily values for a given nutrient may vary depending on a person's age, sex, or physical condition, for example, pregnancy or sickness. Daily values are used on food and dietary supplement labels to indicate the percent of the recommended daily amount that each nutrient provides per serving. So in this case, the serving is 1 tablet. This particular multivitamin provides close to 100% of the daily recommended value, which is a good thing. So this is what I'm talking about. If you look at here, the percent daily value is 100%. Now it means this is a very good multivitamin, because just by consuming 1 tablet, I'm getting all this, and that's 100% of what I need per day. So I don't need to take any more of that. Now, sometimes you'll find some multivitamins written, the percent daily value, it can be written, let's say 1,000%. That means, for example, in that particular serving, the dose I should be taking 20 milligrams of niacin. However, because it's 1,000% of daily value, I'm actually consuming 350 milligrams. Remember, the upper limit is 35. That means I'm consuming in excess of what is required, and this can cause toxicity. The same would apply for vitamin B6. I need 20 milligrams, but because it's 1,000% of daily value, I'm actually consuming 1,000 milligrams instead of upper limit of 100 milligrams. So that's how you read that label. Now, assume, for example, instead of 100%, they tell you it is 50%. Now, that means that if I consume that serving one tablet, I'm only getting half of the vitamins I need. Meaning then I should take at least 2 tablets for me to get 100%. So remember to always read those labels to avoid toxicity. So thank you very much for listening. This podcast was brought to you by Kiki Afia, Happy Birthday Wellness Quiz, your health promotion and disease prevention podcast. We're now doing daily episodes, and we rely on well-wishers to bring you this content. So you can support us by subscribing, liking, or sharing with friends and families. You can also support us through the M-Pesa till number 766 or the mobile number 0720958250. Please remember to tune in tomorrow for the next episode. Until next time, bye-bye.